Hispanics have lower death rates than the general population for most of the leading causes of death, with 3 exceptions: chronic liver disease, kidney disease, and diabetes. And Latinos are more likely to be overweight, according to the CDC, putting them at greater risk for developing serious health conditions. Yet, Hispanics are the most uninsured racial ethnic group in the United States, according to the Office of Minority Health. The uninsured rate among Latinos is still more than double that among non-Latino whites. That lack of coverage, coupled with low average income rates among the Hispanic population, creates serious obstacles to receiving timely and appropriate care. Today, we're joined by insurance agent Marisa Rivera, who is also a diabetic, to talk about her personal health struggles, as well as our insured population here in the Valley. So Marisa, first of all, thank you for joining us today.
Thank you for including me.
And let's talk a little bit about growing up in the Valley. We're both from the Valley. We grew up here. Was going to the doctor something that you remember doing as a kid?
Vaguely. However, I think the time that we started going to the doctor is when you start school. And so you're required to do, have your vaccinations and maybe some exams to get admitted to school. Both my parents being from Mexico, they're used to doing the at-home type of healthcare.
Yeah, so I think that's one of the things that we do growing up. The doctor visit was really for something super serious when something was really wrong.
Absolutely. I recall maybe going to a hospital because I had an accident, but going to the doctor for a cold or a fever, no, those were basically taken care of at home.
And the regular checkups were really done when, as you said, like just when we were going to school and getting ready to start a new school year, you needed your immunization, things like that. Now, did you find that you're yourself mainly healthy for the most part, because you are dealing with diabetes now, but most of your life, have you been pretty healthy?
Thankfully, very healthy growing up, maybe, just a little bit, low on iron, but other than that, vitamins, maybe take vitamins, but for the most part, I didn't reach diabetes till about age 45.
What was it that you were feeling and experiencing at the time that made you go see the doctor and find out that you do have diabetes?
It's funny that you say, what symptoms did I have? I did not have any. It was a regular checkup, and that's how we found out. So, generally, maybe the population understands that sometimes diabetes, you don't feel it unless it's very severe. And once your numbers start being extremely high, then that's when you realize, okay, something's not right. But at the time, I did not realize it.
Well, that's a blessing, because most people find out too late. And then you're dealing with insulin, you're dealing with a lot of more of the serious things when it comes to the treatment. But for you to be able to catch it early was a blessing then.
It was. When you say early, it was no longer pre-diabetes. It was already full diabetes. So I was probably at about an 8 or 9 A1C.
Oh, wow.
And unrealizing that this was going on in my system, so.
And I think two of the most important things that I know that you do is that you have to eat well and you have to be physically active. And I know that you have made a big effort to make sure that you eat healthy, is that right?
Oh, yes. Eating healthy is the hardest part, especially when you work and have, a 14-hour day type thing. And so you try and do the easiest breakfast, like bite a few carrots, celeries, apple, on the go. And when lunchtime comes around, really try and make time for, a small salad. If you're in a hurry, hopefully a good healthy lunch if you have time.
Yeah, and then physically active. I mean, we gotta move. They say that you have to get 150 minutes of moderate, intense aerobic exercise a week. So do you get those hours in?
Not always, unfortunately, not always. Of course, I always try to do a minimum of 30 minutes a day and then go to the gym, for my hour and a half, full workout. If I don't do that, then I hit the gardening, the yard work, things around the house, to just keep active and keep movement.
Well, that's great. What do you find when you're talking to the community when it comes to insurance and coverage within our community here?
Well, when I talk to people, they know they want health insurance. They know they need health insurance. Unfortunately, sometimes if they don't understand their health insurance plan. They let it go, they don't use it, they're afraid to use it. And so I highly recommend those that you already have health insurance, please talk to your agent regularly, ask them questions. That's why we're there, so that you can use it and get all your exams, all your medications. All the plans work, you just need to understand how they work.
Alrighty, and what advice do you have when it comes to your health and making sure that you are making every effort to stay healthy?
Think about why you are on this earth. Is it about your family, your children? You know, and that is why you take care of yourself. You want to be there for them, or you want to see them grow up. You want to see that graduation, that wedding, you know, every family occasion, you know, hopefully, you know, that's what you want. Therefore, you take care of yourself.
Alrighty, well, thank you so much for your time. We really appreciate it. And if you'd like to learn some more information about the health services available, you can visit southtexashealthsystem.com.